Hi, it's the 19th of May 2016, and this is the RheumNow Week in Review. I'm Jack Cush, Executive Editor of RheumNow, and we have a short review of this week's news. A few interesting items from the social feed. A randomized controlled trial appeared in Annals of Internal Medicine, which actually compared the efficacy of Tai Chi to usual physical therapy for knee OA. A 12-week trial with a 52-week study follow-up showed the same outcomes in both groups. Not surprising, but then again, the fact that Tai Chi would do as well as physical therapy may be surprising. The Tai Chi group did have less depression and some measures of quality of life that in fact were better than the physical therapy group, so it certainly seems to be a reasonable recommendation, one that's probably underutilized. A review of lupus patients was conducted looking particularly at the frequency of lupus retinopathy, something we don't often talk about, but certainly can be seen. Their particular group of a cohort that was followed, I think 91 patients, found that 12% of patients had evidence of lupus retinopathy. In fact, it was 96 patients had evidence of lupus retinopathy, and 61% of them it was deemed to be mild. 2/3 had more severe disease. You were more likely to have lupus retinopathy if you were someone who had some degree of renal insufficiency with an elevated creatinine, an elevated ESR, and elevated platelet counts, suggesting ongoing inflammation. So maybe this is particularly seen in patients with more severe disease. Gout patients certainly can get a number of comorbidities. We know that in patients who have type 2 diabetes, the prevalence of gout is about 10%. The coexistence of both in a review that was done was found to be more likely in older people, men more than women, those who are obese, those with hyperlipidemia, and those with neuropathy and a low GFR. So a lot of things you might expect that go when that combination runs together. A lot of other comorbidities and signs of other metabolic syndrome manifestations, but that's the profile that was reported. Another report looked at the how you treat patients with systemic JIA and how frequently you might actually use nonsteroidals. Nonsteroidals do work, albeit in a minority of patients with systemic JIA, but high-dose anti-inflammatory doses of either indomethacin or an equivalent anti-inflammatory may be effective in patients with systemic JIA. The patients who are more likely to respond to this were those who had who are young with SOJA, systemic onset juvenile arthritis, meaning less than 6 years of age. Those with 5 or fewer joints, those with a CRP no higher than 1.3 milligrams per deciliter. So again, the mild end of the spectrum of systemic disease may respond to nonsteroidals. We do know that more aggressive therapies may be needed to control that particular disease. And then lastly, an interesting report of 17 patients from the literature with multicentric reticulonodular histiocytosis. Not an uncommon condition. In fact, I've yet to see one in my career, but nonetheless a perplexing disorder, disfiguring sort of hands and nodules that it can appear. A review of the literature actually showed fairly good responses when TNF inhibitors were used in such patients, often in combination with other disease-modifying drugs. Now, this is a retrospective literature review. There's probably a publication bias. Those who didn't respond are not likely to be reported. But nonetheless, for a difficult condition with not a lot of treatment options, that seems to be good news for that particular rare state. There was an interesting report that appeared in Arthritis Care and Research from Dr. Dalbeth and her colleagues out in Australia, where they actually looked at the news and looking at 21 major publications reporting on gout in the UK and the United States, and they found really a high number of such patients with fairly negative reports about gout, that there's a fair amount of social embarrassment that can be seen in these reports, up to 24% in fact, and another 25% showing evidence of humor or jokes targeting patients with gout or the condition. Not good news, and certainly not nice if you have gout. This was actually coupled with a nice report where there was a review from a survey of 1,000 Americans and 103 gout patients, And this was called the Gout and Uric Acid Education Society Survey. And they found some interesting and worrisome statistics. Number one, that about half the patients did not view gout and the treatment of gout as a priority, although they recognized it was a major problem in their health. A half of the patients did not even consider gout as a form of arthritis. And a half were also embarrassed to have gout. While 40% of these patients were taking urate lowering therapy, maybe only 40%, 25% noted that there was no monitoring of uric acid. These last two reports certainly call for a significant gap in knowledge and education for both patients and possibly for providers in this problematic condition. And lastly, there was a nice review of risk factors for complications associated with bisphosphonate therapy. Certainly, everyone's aware of the unfortunate and rare events of either osteonecrosis of the jaw or atypical femoral fractures that have been seen with chronic bisphosphonate use. This has been analyzed by a number of groups, and in this particular case, this particular report, the Swedish National Database reviewed its cases and came up with some identifiable risk factors. For atypical femoral fractures, they only noted that long-term bisphosphonate use was possibly associated with an increased risk, fostering, again, and supporting the notion that some patients may require a drug holiday to prevent this very, very rare event. For osteonecrosis of the jaw, there were other risk factors in addition to long-term use. That would include IV bisphosphonate use, dental procedures or dental prostheses, cancer, especially multiple myeloma, and even rheumatoid arthritis were all felt to be risk factors for these bisphosphonate complications. So that concludes this week's edition of RheumNow Week in Review. Be sure to go to the website to find the citations if you want more information about these particular reports. Be sure to go to the website and register, as that would help me greatly. Have a good weekend. We'll see you next week.